This is just a little added clarification to the video we made. You're gonna do your skin to wall assessment and hand off at shift change and things. But I wanna go through a few more terms just to go into a little more detail. So one of the terms we talked about was titling. So when you're when the chamber is titling, you're again looking for this line here to go up and down with the breathing of the patient. Now, this one doesn't show this, but the first video did. The other thing I want to talk about in a little more detail is the suction. So, talking about suction, you either will have an order for suction, and then there will be a number for the dial, -20, -10. And so if that's the case, and there's an order for suction, you have to go down to the chamber here and make sure the bellow is out. So we're going to turn on the suction, and you're going to see the bellow come out when your suction is at where it needs to be. So see that bellow just came out. Our order says for suction to be at -20, which this dial is how you get to -20. There's a 15, there's a 10, but normally it's just at 20. Okay, so that's an order with suction. Now you might see an order to water seal, and that means we're gonna take the patient off suction, and the chamber is going to just drain with gravity. So you're not going to have suction when the order says to water seal. You'll sometimes see that order when the patient's going to imaging. They'll say, place patient to water seal during transport. Or sometimes they'll just have it at water seal with the patient in the room as well. So the other term I want to talk about is air leak. So every time you come in the room, you're assessing for titling and you're looking for air leaks. So I'm going to hook the suction back up, and I'm going to show you again, this chamber is your air leak chamber. Now, if there's an air leak, you'll see bubbles continuously in this chamber. That is an air leak. Now, what you might see is a little bubbles in there with the breathing, but that's okay. That's an air leak, what we just showed you. Yeah, and I think that's it for the terminology part. Again, assessing skin to wall every shift, and then every time you come in the room, looking for titling and air leaks, and then fixing along the way whenever you run into a problem. Thank you.